Welcome to the AUSA Warriors Corner with the Desert Medics of 3rd Medical Command. I'm Lieutenant Colonel Nathan DeVoe, and I'm joined by Major General Joe Robinson, Commander of the 3rd Medical Command Deployment Support, headquartered at Gillum Enclave in Forest Park, Georgia, and Major Aaron Velasquez, Commander of Urban Augmentation Medical Task Force 332-1. Major Velasquez, during this video we just watched, Major General Robinson spoke to this being the first time in history that Army medicine is the warfighter and is at the tip of the spear. Can you explain what those words meant to you then and what those words mean to you now that your UAMTF has completed its mission?
Well, sir, to me, it means that we're part of the team, that we have an essential role to play, but this is why we do what we do. We're here to be ready. We're here to provide quality care and to make a difference.
Were soldiers assigned to your UAMTF able to leverage their civilian skill set? And how does the Army Reserve prepare its soldiers to train alongside its civilian counterparts?
That's a really good question. I think Army Reserve soldiers really come with an expertise of not only having their military experience, but bringing their civilian capabilities as well. So in our UAMTF, for example, we had several soldiers who, say for instance, a couple of them were 68 whiskeys. However, in the civilian sector, one was an ER nurse and one was a med-surg nurse. And another capability, we had a med-surg nurse who was actually an ICU nurse in the civilian sector. So they're able to bring that knowledge, that expertise to the table. Even though they're working in their military capability, they're able to assist and provide that expertise as needed, which was definitely a true asset. So with regards to your other question, what does the Army Reserve, how do they get us capable and ready? There are a number of instances, a number of examples to explain that. One, for instance, a lot of units partner with military treatment facilities. So the units are able to actually go into those treatment facilities on the weekends, in addition to during their annual trainings, to get additional training and also to give back a little bit to that community as well. We also have IRT missions, which are another example. They're innovative readiness trainings. So that's another way that our soldiers get that additional training and again are giving back to the communities that are in need.
Thank you. I'd like to follow up with another question for you, Major Velasquez. Were there any particular medical skills or procedures developed during through your partnership with these civilian providers? And were you able to share anything with the civilian providers, or is there anything in particular that you and your soldiers were able to take away from your time working with civilians that you can utilize now in your formation?
Oh my gosh, there's plentiful, quite many examples. There is definitely an inner exchange of information, procedures and protocols that were shared and exchanged while we were there. A couple quick examples. One was the proning team. So that was something that the hospital was already utilizing. They were already doing that treatment modality when we came. They had just started it. So when our team members came, they were very excited to have us because we were really a force multiplier. So they utilized some of our skills in the sense of we were able to provide an additional structure. We were able to streamline the procedures. So instead of just having a couple teams, we were able to provide 24-hour coverage. So we had teams working during the day and we had teams working at night, providing that critical need to chronic COVID patients. And so one of the things that came out of that was a video. So University Hospital partnered with some of our team members to create a video that really allowed the proper procedures and techniques to be shown for training purposes later on. Another example had to do with mental health services. So when we came in, one of the team members of University Hospital was trying to implement and really trying to get started, so to speak, develop a resiliency program. And so our behavioral health team was able to come in using some of the principles of Army resiliency training and Army COSC techniques to partner with that team member to provide real-time training, put things in action immediately. So instead of waiting for university hospital members to come and seek services and seek treatment, both teams were able to go out into the hospital and meet with hospital staff members on their floors when they were working to provide assistance and support as needed. So those were just a couple of examples. There are some examples that I've talked with some of the soldiers about of different techniques and methods that they used in New Jersey that they've been able to bring back to Florida specifically. One such instance is just writing some stats on the windows, on the glass partitions. And that enabled some of the staff members to, go in and out of the rooms less. So they've been able to bring some of those techniques and tactics back home with them, definitely.
Thank you for that. The next question I have is for Major General Robinson. Sir, can you please speak to how the UAMTF, the success of the UAMTFs has changed the Army Reserve's perspective on readiness? And are future deployments or contingency support operations affected by the need for the UAMTF?
Yes. So the most important thing that the UAMTF showed was that we could respond to an emergency at speed. One of the things that we've been training on for several years now is the relevance of speed and getting to the fight in a timely manner. And that's been the big question. And the UAMTF, in what we were able to do in putting the people on the ground in less than 2 weeks, and it's actually in as little as 9 days, shows that there's a relevance, and I spoke to that in the other video. The other thing that it does for the Army Reserves is it shows that we have a new capacity that we can give to the country in the time of national emergency. Hurricane response, where we've always looked at these federal medical stations as they were called in the past. We now have the ability to help in the response that before only the National Guard would have been called to do. So this gives us a relevance not only in a wartime mission, but also in helping with defense support to civilian authorities.
Roger, sir, thank you. Does that work? Does that all impact our ability to project support abroad for future missions or other contingencies?
Again, I think it's a question of relevance, and that is the question that was answered with our response during the COVID crisis, and that is our ability to get somewhere where we needed to be when we needed to be there. And I believe that the question was answered not just for Army medicine, reserve medicine, but for the Army Reserves in general, that we can put boots on the ground when we need them there. And that makes the Army Reserve relevant in any conflict.
Thank you, sir. I've got one more question for Major Velasquez, and I wanted to ask, on the heels of Major General Robinson's response about readiness and relevance, Major Velasquez, how did you ensure readiness at the unit level, and what steps did you take to protect your soldiers from COVID-19?
Well, that's a tricky question with regards to readiness. Everything was very fast, right? So most of us only received a 2 days notice to be ready, so to speak. So the soldiers had to already be ready with regards to that question. But as far as protecting against COVID, that was not only my top priority, but the military's top priority too, is to keep the safety of our soldiers and to protect them. So from the very beginning, making sure that when we started in the hospital that all the PPE was going to be provided, that there wasn't going to be anything missing. And in the case that there was something in the future, we prepared in addition to, so for having a resource through the military as well. So we made sure that all the procedures and protocols were being followed, that everyone knew what to do, how to do it, and where to ask if they had any questions. The hospital really stepped up and provided a lot of those resources for us, making sure that we were taken care of and the soldiers were taken care of. But we didn't just do that at the hospital. we followed those proper procedures and protocols even when we were off duty. So even at the hotel, making sure that everyone was always wearing their mask and keeping distance. And the only time the soldiers were really allowed to take off their mask was when they were in their room, in the privacy of their own time. So we really made sure that the soldiers were protected and safe.
Thank you, Major Velasquez. Final question for Major General Robinson. Sir, with all that's been discussed today and what we saw in the video, sir, can you speak to what does the success of the UAMTF mean for the role of Army medicine and the Army Reserve's role in shaping future operations?
The UAMTF has shown that we are capable of being where we need to be. At the same time that we were responding to COVID, we still had other missions throughout the world. We have several missions in war zones still at this time, and we were still able to mobilize and equip and get those soldiers where they needed to be. Again, the biggest point I think to be made here is the relevance of the Army Reserve and Army Reserve medicine, that we can be relevant in the fight, in any fight that the United States has to be in, be it a COVID response at home or a war on another continent. The other thing that the UAMTF showed us is that we can do things a lot quicker. We don't have to go to a mobilization platform and sit there for 1 to 3 months and do things. During the COVID response, we had 14 days basically on AT orders to get everybody SRP'd, to get all the proper paperwork done, to make sure that they were good to go in any kind of emergency. All the while, along parallel lines in the Pentagon, they're working mobilization orders so that at the time that the AT orders ended, the mobilization order commenced. And so we were able to streamline that process, which would have taken literally months in the past, and got it done a whole lot quicker than any other time in history. So the mobilization piece of it, the demobilization piece of it, being able to do a lot of things virtually has really impacted the entire reserve and probably the active component as well on how well we can do things and don't have to be at a certain place to do it.
Thank you, sir. I appreciate that. I want to thank you both, Major General Robinson and Major Velasquez. I thank you both for sharing your time and your experience as it pertains to the Urban Augmentation Medical Task Force. Thank you for your service and everything that you've done in support of the COVID-19 prevention and response efforts. And thank you for being with us at the AUSA Warriors Corner.
Thank you for having us. Appreciate it.